This is Picturing Medicine. I'm going to talk through a Picturing Medicine diagram on abdominal pain. Picturing Medicine iPhone and iPad apps contain a series of visual aid memoirs produced to help medics recall information quickly and accurately. The drawings are designed to be memorable and visually associative. They are often quite peculiar to look at, and this is intentional. Vivid, strange and colourful images are vastly more helpful with regards to memorising facts and accurate, rapid recall of information. One can also remove the labels from these drawings, which helps even more with learning, testing and teaching. For more information, please visit www.picturingmedicine.com. This diagram summarises the different causes of abdominal pain. These different conditions tend to cause pain that presents in certain specific parts of the abdomen. Therefore, the different causes have been grouped in this diagram into right upper quadrant pain, RUQ, left upper quadrant, LUQ, right lower quadrant, RLQ, and left lower quadrant, LLQ, as well as epigastric and central regions. Remember that this is only a guide. Pathology can and does present in unusual ways. There is no substitute for experience. Nevertheless, we hope that you will find this diagram helpful in learning some of the typical patterns to look for. Starting with right upper quadrant pain. Pain in this region can be associated with liver pathology, for example hepatitis and congestive hepatomegaly. Other possible causes could include gallstone-related disease, for example acute cholecystitis, and also pathology affecting the livers, for example kidney stones or infection, referred to as pyelonephritis. Remember also that kidney stones often cause pain that radiates through to the back. Don't forget to consider right lower lobe pneumonia, which can cause pain in the right upper quadrant of the abdomen. The appendix is a surprisingly mobile organ, and although it does not often cause pain in this region, it can lead to pain in the right upper quadrant. Duodenal ulcers may also explain pain in this region, as well as kidney stones. These duodenal ulcers can cause pain that radiates through to the back. Left upper quadrant pain may relate to the spleen. A splenic rupture, for example, can occur, especially in association with trauma. As with the right upper quadrant, one must consider lower lobe pneumonia, kidney stones and also ulcers, for example gastric ulcers. Perforation of the bowel is illustrated here as a potential cause of pain. Perforation of the bowel can of course happen in a wide variety of locations, however. Epigastric pain may relate to a problem with the pancreas, for example pancreatitis, or the gallbladder, for example cholecystitis, or the stomach, for example peptic ulceration. Once again, any of these conditions may also be associated with back pain. Don't forget to consider myocardial infarction, and once again, perforations are a potential explanation. Central abdominal pain is classically associated with early appendicitis. This type of pain is a referred pain. It's caused by inflammation within the appendix. When the inflammation extends to involve the peritoneum outside the appendix, the pain experienced tends to move to the right lower quadrant, where the appendix is normally located. There are, of course, many other explanations for central abdominal pain. Pancreatitis and an abdominal aortic aneurysm can explain central abdominal pain. Again, classically these are associated with back pain. Mesenteric thrombosis and intestinal obstruction are important conditions which can present with pain in the central abdominal region. Pain, however, in association with these conditions can occur elsewhere on occasions as well. Right lower quadrant pain often relates to the ascending colon, and more common causes include appendicitis and inflammatory bowel disease, especially Crohn's disease. Inguinal hernias are an important cause of pain in this region as well. In children, mesenteric adenitis can cause right lower quadrant pain. Don't forget to consider kidney stones as well. A Meckel's diverticulum is illustrated here on the diagram. This is a congenital outpouching from the small bowel, which can lead to pain when they become infected or inflamed. Often, Meckel's diverticulae are associated with what's said to be the rule of twos. They tend to occur in about 2% of the population and are usually located 2 feet from the ileocecal junction. When present, they are often about 2 inches long, 2% are said to be symptomatic, and they most commonly present at 2 years of age. In female patients, it's important to do a pregnancy test to check for ectopic pregnancy. This is a potentially life-threatening condition. Female patients may also experience lower abdominal pain due to a number of other possible pathologies. Ovulatory pain, termed Mittelschmerz, is one potential explanation. Other causes could include rupture of an ovarian cyst, abscess within the fallopian tubes or ovaries, salpingitis, and torsion or twisting of the ovary. Moving finally now to the left lower quadrant. Left lower quadrant pain often relates to the descending colon. There is, of course, no appendix in this region. There may be diverticulae in the sigmoid colon, however, termed diverticulosis. These outpouchings tend to develop with age and are associated with the low-fibre Western diet. If they become infected or inflamed, termed diverticulitis, the patient will often experience left lower quadrant pain. Remember also to consider inflammatory bowel disease, i.e. ulcerative colitis and Crohn's disease. These conditions may well cause pain in the left lower quadrant. As with right lower quadrant pain, kidney stones, colonic perforations, hernias, ectopic pregnancy, and all of those gynecological causes must be considered too. A mention finally of bladder pathology. Conditions such as urinary retention and urinary tract infection can also cause abdominal pain, this would tend to be lower abdominal pain. And so there we have a visual summary for the vast majority of the different causes for abdominal pain, grouped in terms of their region. Don't forget to hide the labels when using this diagram. By doing this, you can test yourself and maybe even test others as well. By removing the labels, the image itself becomes much more vivid and arguably much more memorable. Try it for yourself. See how you go.